UroPatient. Tune in and see. Prepare your health for you and me. Knowledge is power. We make it clear every Saturday morning.
Hey, good morning, everyone, and welcome to UroPatient Podcast. I'm your host, Vic Senese. Glad to have you on board. Hey, if this is your first time checking us out or you haven't subscribed, what are you waiting for? Go ahead and do that. So today's episode is going to be kind of a nice, quick and short to the point. If you had a catheter put in, you went home, maybe you had surgery, and the doc was nice enough to want to save you coming into the office early in the morning to have it removed, and will let you remove it yourself, so long as your healthcare worker has said it's fine. I'm going to go through a step-by-step how to remove your own catheter. It's simple. I like to send my patients home and let them remove their own catheters, because then they can come to the office later on and I can scan their bladder, see if they've emptied out. Otherwise, like I said, it's a trip in the morning and it's a trip in the afternoon. 2 trips to the office, parking, all that other rigmarole. So let's get on with how simple it is, and we'll take any questions if you have them in the comments. But
Hello there. If you're watching this, it's probably time to remove your urinary catheter at home. We put together this simple guide to walk you through every single step so you can feel totally confident and prepared. Let's get started. Now look, it's completely normal to feel a little bit nervous about doing this. I mean, taking out any kind of medical device can feel like a big deal, but I really want to reassure you, this whole process is way more straightforward than you might be thinking. You can absolutely do this yourself, really. We've designed this explainer to give you super clear step-by-step instructions. You'll know exactly what to do, what to expect, and how to do it all safely. We're going to walk through it together. Okay, first things first, let's get to know the catheter itself. The good news is there's really only one part you need to pay attention to for removal, and trust me, it's very easy to spot it. So you might look down and see 2 or maybe even 3 of these little openings or ports. It can look a little confusing, but for our purposes today, you only need to focus on one of them. If you see a third one, that was likely used for flushing fluid after surgery, and you can completely ignore it. And here it is. The one and only part you need to find is the balloon port. And here's the trick. It will always be the one that has some color on it. This port connects to a tiny balloon way up inside your bladder that's holding everything in place. To get the catheter out, we just need to let the air, or rather the water, out of that balloon. It's really that simple. All right, let's talk about getting ready. You'll be happy to know you do not need any special medical equipment for this. Everything you need, it's probably already right there in your home. Yep, that's the entire list. All you're going to need is a standard pair of scissors from a drawer, nothing fancy or sterile required, and you'll want to do this in a place that's comfortable, private, and easy to clean up, like your shower or right on the toilet. And the reason for doing it there is just practical. When you deflate the balloon, some water is going to come out. And when you pull out the catheter, a little bit of urine might follow. Doing this in the shower or on the toilet just means zero cleanup. No mess, no fuss. Okay, we are ready for the most important step, deflating that little balloon. And there's a very simple and totally reliable way to make sure it's completely empty. This is exactly why we use scissors. As Dr. Byrne points out, you might think a syringe would work, but sometimes a syringe just doesn't pull out all the fluid, leaving the balloon partially inflated. But using scissors to just cut the port, that guarantees that every last drop of water drains out. It really is a foolproof method. So here's what you do. You're going to take your scissors and make one clean, firm cut right through that colored balloon port. Don't be timid about it. Just a confident snip is all it takes. The second you cut the port, water will start to flow out. Just let it drain. Now, depending on the size of the balloon, it could be a little bit or a decent amount. The most important thing here is just to be patient. Wait until you're absolutely sure the flow has completely stopped. Excellent. The balloon is deflated, which means the hard part is officially over. So now, let's just put all the pieces together for that final, gentle removal. So let's just recap the whole process right here. 1, you're sitting comfortably. 2, you've got your scissors. 3, you make that firm cut on the colored port. 4, you wait patiently for all the water to drain out. And then for the final step, you just take a nice deep breath, relax, and gently and smoothly pull the catheter out. You did it! Now, before we finish, let's quickly go over the most important safety check and what to look for to know for sure that everything went perfectly. This right here is the single most important rule.
The catheter should really just slide right out. If you feel any kind of significant resistance, or if it feels stuck or painful, stop pulling immediately. Do not try to force it. So let's be super clear about what that means. Feeling a little sensation of pressure as it slides out, totally normal. But feeling actual resistance where it feels like it's caught on something, that is your signal to stop. If that happens, no big deal, just leave it be and give your doctor's office a quick call for advice.
And here is how you'll know you had a perfect removal. Once the catheter is all the way out, just take a look at the tip. You should see a crumpled, kind of bumpy-looking end. That's the completely deflated balloon. When you see that, you know you did everything perfectly. And that's all there is to it. You've just taken an active, really important step in your own care and recovery. We hope this guide helps you feel prepared and confident. You did great.
It's really that simple. So if, again, your healthcare provider has to give you permission to do this, but if they do, you can just follow that guideline step by step to do it yourself. Just remember, you cut the colored cap off. Scissors works best. Some people wonder why they don't give you a syringe. Trust me, I've taken a number of these out, and with the syringe, sometimes you draw the water out and you haven't gotten all the water out. You don't want to take a partially deflated balloon out. So hopefully this is helpful for you. Just be sure to watch our other videos because we have a ton out there. This is number 120. So lots of videos for you to choose from. Go to UroPatient.com. You can find all of our past episodes. Now, next week, buried penis is a condition that many men experience, but few talk about it. It can impact hygiene, urinary function, and sexual health, yet it's often misunderstood or misdiagnosed. Next week on UroPatient, I'm going to break it all down for you, why buried penis happens and treatment options that can restore function and confidence. So, yep, be sure to join us next week to learn more about buried penis. What is it, how it works, and what we can do about it. Until then, enjoy the rest of your day, and we'll see everybody next week on UroPatient.
From research up